basically you can get complication while you are inserting the line. So think about it, you're inserting a central line, you can hit the lung and get a pneumothorax. You can hit a blood vessel and get bleeding, and you can misplace it actually inside the lung, right? You can also get line-associated problem. The line can be kinked, can be blocked, can get a thrombus, can get infection, and also can lead to thromboembolic pneumonia as well. Obviously, if you get infection, there is a higher risk of getting sepsis as well. There are some metabolic complications for total parenteral nutrition, and this is related to the feed or the actual constituents that you're giving to your patient. So sometimes they get, acute metabolic issue, such as refeeding syndrome, or hyper and hypoglycemia, electrolyte disturbance, hypertriglyceridemia, and hyperchloremic metabolic acidosis. On the other side, you can get chronic metabolic issue, such as liver disease, cholelithiasis, and metabolic bone disease, all right? Why would we get cholelithiasis, for example? The key point, when the cholecystokinin is being produced and lead to contraction of the gallbladder, that happens when the food is being introduced in the first part of your duodenum, okay? So if you're not using your gut, right, if you're not using your stomach, this process is not going to happen. The cholecystokinin will not be produced. Therefore, they are at risk of having gallstones. Systemic illness related to that, you can get ventricular problems, specifically due to carbon dioxide retention, which is being produced from the glucose, okay? And gut atrophy because you're not using it, basically, okay? So these are the complications of total parenteral nutrition. However, it's written a little bit simpler way, and the complications of parenteral feeding: line-related, infection, thrombosis, pneumothorax, and hemothorax; feed-related, fluid and electrolyte imbalance, and hyperglycemia. However, I personally prefer this answer. It's a little bit more detailed, and you sound in the exam much more confident if you're able to reach to this point. From which